A new report on overdose deaths released today by the Centers for Disease Control indicates more than 70,000 Americans died of overdoses in 2017. That is higher than the number of people who die in car accidents or by gun violence. Pam Surano spoke with the medical director at Gateway Rehab for his insight.
Gateway Rehab's new medical director has only been on the job a little over a month. With a background as well in emergency medicine, he says there are none sicker than those battling addictions.
Unfortunately, the rates of addiction are still on the rise in this country.
On the rise and a record, according to a new report released today by the CDC, something Dr. Jason Kirby, the medical director at Gateway Rehab, knows too well. The CDC report ranks Pennsylvania, as well as West Virginia and Ohio, among the highest nationwide in overdose deaths. Pennsylvania had 44 deaths per every 100,000 people, while states like Texas had 10 overdose deaths per 100,000 people. The reason is also opioids that are being mixed into every street drug.
The rise in fentanyl. Fentanyl is a very big contributor to the overdose rate.
With a strength 50 times more powerful than heroin, fentanyl is at the root of the overdose rate, reaching its record in 2017 at more than 70,000 deaths. And in Pittsburgh, the reason is also geography.
When you look at Pittsburgh strategically, it's very strategically placed in between Chicago and New York, two major hubs in the drug trade.
Dr. Kirby says if it hasn't affected you personally, it will.
If somebody has not experienced the despair of watching a family member or a friend having to struggle with this disease, then they will.
Dr. Kirby says every demographic has seen an uptick from teens to people in their 80s. Dr. Kirby stresses the need for medicine like Narcan, an overdose reversal drug.
It needs to be available. It is highly effective when used correctly at bringing people back from the brink of death.
Despite the misunderstanding, Dr. Kirby says medicines like Narcan are prevention. In many cases, he says without one more day, there can be no recovery and/or survival. Pam Surano, KDKA-TV News.